Barbados remains the Caribbean island with the most comprehensive immunization program. However, Chief Medical Officer Dr. the Most Honorable Kenneth George stresses that despite measles being one of the most infectious diseases, there has been a drop-off in the administration of the MMR2 vaccination, which is given at 18 months. And he remains concerned as there's an uptick of measles seen in some neighboring countries. Dr. George notes it is a preventable disease, with the MMR vaccine being one of the required vaccinations for children in Barbados.
Measles remains the Achilles heel of several persons in public health because of its ability to spread so rapidly in a population, particularly if the population is not appropriately immunized. We immunize our population at 12 months and 18 months. We give MMR1 and MMR2. The levels of MMR1 are at about 85%, and the levels of MMR2 are about 75%. They are not where they are. We prefer it in the 90s and higher.
Health practitioners have been advised to identify any unusual rash and fever under the Ministry of Health's rash and fever surveillance mechanism. Measles is characterized by a distinctive rash and fever, which typically starts on the head and face before spreading downward.
We continue to monitor the situation overseas. We know that people can travel while infectious and not showing overtly rash. It occupies a lot of the time for Leslie, who reports on fever and rash as part of her surveillance protocol. And we are taking this extremely seriously, and we will continue to beg the public to take the simple vaccine, which has limited side effects and has so much protection to offer you and your family.
In addition to vaccination clinics at the polyclinics, the Ministry of Health is also facilitating Saturday clinics for those who can't attend during the week. Rachelle Agard, CBC News.